Welcome, everyone. Simon Rosenberg, Hopium Chronicles, back with another great event for you today. I've got somebody with us today who I have followed. It's one of these folks on the internet, right, that we follow, admire, or learn from, who I've never met. And so joining me today is Charles Gaba, and who's is a leading healthcare policy and data analyst, and somebody who I have learned so much from in recent years. Charles, welcome.
No, thanks for having me. And yeah, great to meet you, virtually meet you as well. Appreciate it.
And so listen, I brought you on because we've been talking a lot about inside the Hopium community about this kind of multi-pronged assault on public health in America, right? We have what's happening to the reconciliation bill. We have everything Kennedy's doing to unravel the vaccine regimes and cut medical research. You've been doing a lot of work in recent days on what it is that we really think is going to happen if the reconciliation bill passes. And I wondered if you could sort of just bring us up to speed, because I think what you've been suggesting is that the impact on the American people could be far worse than is currently being represented in the conversation.
Yeah, absolutely. And yeah, so it depends on, there's been all these numbers like flying around the last few weeks, partly because they kept changing the bill, the versions, the drafts of the bill before the House voted on it. And of course, now it's moving over to the Senate, and there's going to be changes made there as well. So the Congressional Budget Office, they've come out with several different projections. And there have been other projections from various, healthcare think tanks and that sort of thing about the impact on healthcare coverage, on healthcare costs, expenses, that sort of thing. And obviously, it's not just healthcare. There's a whole bunch of other areas that are impacted as well. But I'm a healthcare guy, so that's my thing. And so most of the focus, I'd say probably like 90% of the focus has been on the impact on Medicaid, right? And on Medicaid expansion in particular. So there's around close to 80 million people enrolled in either Medicaid or the Children's Health Insurance Program, CHIP, which is sort of tied in with Medicaid nationally. But of that, around 20 million, around a quarter of that are people on the ACA expansion portion of that. And that's where most of the focus has been, and rightly so, because that's a huge number of people who are very much at risk of losing healthcare coverage because of this. If this bill were to pass and be signed into law and implemented as it stands, there's been far less attention paid to the other shoe in the healthcare coverage field, which is the ACA exchange enrollees, and there's around 24 million or so of them, including myself. My wife, son, and I, we are, my wife and I are self-employed, and so we're on an ACA exchange plan ourselves here in Michigan. And many of those folks are going to be in deep trouble come January as well if this bill goes through, due to some provisions that are included in it, but also due to one big provision that is not included, which is an extension of the Inflation Reduction Act subsidy enhancements. As folks may know, the ACA includes financial subsidies on a sliding scale for enrollees, but it was always fairly anemic. Like it was decent for some people, but it was never really generous enough for most enrollees, which is where a lot of the complaints came from, especially in the early years. Over the last 5 years, back in 2021, the President Biden and Democrats in Congress, they passed first the American Rescue Plan Act, and then extended through the Inflation Reduction Act. They beefed up those subsidies and basically brought them up to where they really should have been in the first place, making them more generous across the board, and also removing the hard cap, the hard income cap on them. And that's basically what has made ACA enrollment, ACA exchange plans actually affordable. It's holding up the affordable part of the Affordable Care Act. And those are currently scheduled to expire at the end of this year, unless they are extended or made permanent, which is what I hope happens. So between that and some other stuff, which I can go into if you want, that is included in the bill, ACA exchange enrollees are going to be facing massive premium increases, deductible and copay increases, and so on, to the point that several million of them, possibly myself included, would basically be priced completely out of the market altogether. So
So you're saying what you've been saying is that there are 46 million people really that are potentially going to be dramatically impacted by the current version of the bill, that either they could lose insurance or their costs will go up so much that it will be difficult for them to maintain insurance. And you even also have been writing a lot about the new sort of hurdles that people have to go through to both gain coverage and to maintain it. If you can talk a little bit about that, because part of what I've been taking away from your writing, and we heard Speaker Johnson say this over the weekend, he literally said he thinks many people are going to choose not to have health insurance anymore, right? Choose, right? It will be their choice. It won't be something that happened to them, right? But I think that they, beyond the sort of the malevolence of what's happening here, is that not only are there just going to be straight cuts, but they're creating new barriers for ability to gain access to health insurance, and then to maintain it over time is also going to become very difficult. So if you can talk a little bit more about that.
Sure. And again, there's been much attention paid on the Medicaid. So again, there's the Medicaid side and then there's the exchange side. On the Medicaid side, there's been a lot of talk about the so-called work requirements. And it's important to note, it's not work requirements, it's reporting requirements. The vast majority of people enrolled in Medicaid through the ACA expansion, of those 20 million people, the vast majority of them are already either working full-time or part-time, or attending school, or are caretakers for a sick relative or whatever. The vast majority, according to KFF, I believe like 92% are already engaged in some sort of activity that would presumably be covered by the requirements of the bill. It's about the reporting of that, and that's where the rubber meets the road, and that's been tried, and it has to be done every month, I believe, where you have to basically you have to track and report into some sort of I presume a web-based system, I would imagine, on a monthly basis. I would guess. The exact details I'm not sure about how it would work, but that may be up to the maybe vary by state, and so on. And it's been tried in several other states. Back in during the first Trump administration, there was a brief period where Arkansas imposed work reporting requirements, and within a few months, something like 18,000 enrollees, the vast majority of whom were working or were in school or volunteering, were doing what they were supposed to do, were kicked off the program. Even right now, there is one reporting requirement program for Medicaid in place in Georgia. It's called Georgia Pathways, where it was touted by Georgia Governor Kemp as this miraculous thing, and supposedly, I believe, up to like 200,000 Georgians were supposed to be eligible for it. To date, only like 7,000, I believe. It's been in place for about a year and a half now. Only 7,000 Georgia residents have actually enrolled. And that, again, is because the whole point of these reporting requirements is to kick people off the program. That's where the financial savings, the hundreds of billions of dollars that talk about savings, that's where that comes from, is from people not being in Medicaid. Well, the best way to do that is to impose high bars, high red tape and hurdles and things like that. Not since most Medicaid enrollees are tend to be low income, right? Especially the expansion population. They may not have a computer. They may not have an internet connection. They may have a really bad connection. Maybe they're still on dial-up. Maybe they have bad service. Who knows? I know in the case of Arkansas, I remember reading one story where apparently the website where you had to go to report shut down. Like, you couldn't report after 9 p.m. for some reason. It was basically taken offline after 9 p.m. each day. So like, you work a full shift, you go to report like you're supposed to. Oh, sorry, you can't. So things like that. Now, obviously, it's possible that it would be, there would be provisions in there that would say that it has to be made easy and simple or whatever. Yeah, I don't buy it for a minute. So that's the Medicaid side, and there are other things, there are other hurdles on the Medicaid side as well. But on the exchange side, in addition, as I said, the biggest thing is the enhanced subsidies expiring, but the the bill includes a bunch of other nasty little provisions, some of which are actually already in place through regulatory changes by the Trump administration. So, basically the HHS, or the CMS, the Centers for Medicare and Medicaid Services, CMS, they put through a proposed rule that would basically do things like cutting the length of the open enrollment period down from 75 days down to 45 days, basically cutting it almost in half. So people would have less time to enroll, and if you miss the deadline in December 15th, too bad, you're out of luck. Things like removing some of the special enrollment periods, basically making it harder for people to enroll outside of the official time period. So they shorten the time period, then make it more difficult to enroll outside of that if you have special circumstances, things like that. They're also making it more difficult for people to, basically you have to provide additional paperwork and red tape, and so go through red tape and such to prove that you're eligible for the subsidies, things of that nature. And a lot of these are not, some of them may seem fairly small or minor, but they add up quite quickly.
Yeah, I mean, I think that part of, as somebody who worked for Bill Clinton in 1992, we had the effort to pass, the Clinton Healthcare Initiative in 93, 94, which failed. And then the ACA comes along, and we've seen this very dramatic drop in the uninsured, from 15, 16% down to, it's been 7, 8%, right? I think it's been half of what it was. An incredible social policy success. In now Joe Biden left office with the lowest number of uninsured in modern American history. Health insurance obviously contributes to sense of well-being. It gives you also the ability to take a new job or to be self-employed, right? Like you are. It creates vitality in the economy itself. People are not dependent upon a single job to have their health insurance. They can take, it brings entrepreneurship and innovation into our economy. But I think the thing that I am really struck by, and I know this isn't exactly in your wheelhouse, but if you take as much money out of the healthcare system that we are, and then you add to that the stripping out of extraordinary amounts of money into basic health research that is happening through the gutting of the NIH and National Science Foundation and all the other ways that they're cutting basic research, the entire kind of current economics of the healthcare system in America is all of a sudden there's going to be a huge chunk of money that's just going to disappear. Mm-hmm. And it doesn't only mean higher costs for workers and less access to care, but the system that is providing that care, the doctors, the nurses, the hospitals, the infrastructure that feeds off of all this money is also now for everybody, right, is going to be, severe, is going to be cut back significantly, which is going to impact the healthcare outcomes for everyone in America. I mean, I think in the Republicans' mind, what they're doing is strategically making sure that those people in their minds, right, those people who are not their people are going to get less. But the truth is we're all going to get less. We're all going to be more subject to and you add to it what's happened with USAID, right? And all these global systems we had of tracking diseases and preventing bad outcomes and global health outcomes, right? We've removed all of that. And now we're also now unraveling the American vaccine system. And we're stripping huge amounts of money out of the leading research hospitals in the United States, the cutting edge doctors who are solving the most important problems of the world that all of a sudden aren't going to have any money to do the research or even potentially even work at that hospital any longer, right? Because the entire grant program. So this is going to be an extraordinary shock to the entire healthcare system of the United States. And I wondered if you could just, as somebody who studies the economics of this stuff and understands in a granular way, the sort of the 8 yard, 3 yards in a cloud of dust that we just went through to get all these people insured, and to give them a better life and to give them greater access and security that you get from having access to healthcare. I mean, what could happen to the American healthcare system with this kind of cascading shock that we're going to go through over the next couple of years?
Yeah, well, certainly on the left side of the aisle, right, in the Democratic Party, and over the last any number of years, obviously there's been a lot of debate about Medicare for all, single payer versus strengthen the AC, what should our path forward be, and that sort of thing. But the one thing I think everyone would agree on across the spectrum is that the U.S. healthcare system, regardless of whether you look at it as a glass half full or half empty, it's definitely precarious. It's basically, I call it healthcare Jenga. It's basically a Jenga tower with lots of pieces, lots of interconnected, Rube Goldberg machine. I mean, use the metaphor you want. And if you pull on one thread, if you pull one piece out, too quickly, there is definitely a ripple effect across the rest of it. And I mean, just to give a very simple example, when, I think you mentioned, rural hospitals. Well, that's the thing. If you have people, if they're relying heavily on Medicaid dollars and those Medicaid dollars aren't coming in, you're going to see some rural hospitals are going to collapse, or hospitals that are on the verge now, that are just barely eking by. What happens when those go down? Where do those people go? Well, if they're able to, and they're sick, then some of them are going to have to travel a long distance to a big city hospital, right? So now they're still sick, they're still injured, they still need treatment. So they're so instead of going to the rural hospital, it shuts down, and now they go to the big city. That puts an increased strain on that hospital system, right? Which is also going to lose a lot of funding as well, and so on. And there's any number of examples you could use, but yeah, I think it's going to be devastating, and it's one of those things where if it wasn't real, it would be fascinating to watch. I don't know if fascinating is the right word, because it's more horrifying.
Right. I think we're going through this on a variety of fronts right now, right? The horror movie is actually here now. It's not, it's not fiction any longer, right?
Yeah. I mean, I'll give you another, quick example is, for example, and this is something in the bill that I actually had to double check with like 3 different people to make sure that I was clear on this. If you're kicked off of Medicaid expansion because you fail, let's say you're on Medicaid expansion in an expansion state now, and you get kicked off of it because you fail to meet the reporting threshold, apparently, like normally from your income, you should be, in a lot of cases, you should be eligible for ACA exchange subsidies instead. It's like, okay, well, that's not so bad. You lose Medicaid, but at least you get the subsidized private plan. Apparently not. Like, apparently there's a portion in the bill that says that no, even, that you're not, so now you're not eligible for either. So now you join the Medicaid gap population, which there's several million people in those in the states that still haven't expanded the program. So yeah, it's all interconnected. And as you mentioned, National Science Foundation, Institutes of Health, and so on, all the basic research. There's tons and tons of research and development that's based on this funding. And of course, that means that there's whole economies that are based on this. Not to mention the ripple effect across, just like when the auto industry has a problem, the tier 2, the tier 3, all the peripheral companies and businesses surrounding them, they're going to be impacted as well. If you work at a coffee shop near a research university and they've lost, half their staff because they lost their federal funding, now you're going to have half as many people coming in for coffee. So you're going to, you might have to lay off some employees there. So in industries that don't appear to have any direct connection to healthcare, yeah, they all do.
I want to just end with this, because I could talk to you for a really long time, and I think we're trying to stay on time, but I just speculate. And again, I'm not holding this to you, right, in this, because you stay focused and narrow on the things that you know best. But what's going to happen in the States if this all happens, right? These sick people are going to be living in these states. Mm-hmm. And, they are now going to have less access to care. It means that we assume we would see the homeless population in the United States significantly increase. We would see rural hospitals, including in red states. I mean, I think one of the most interesting things that isn't really well understood is that, this bill is going to really hurt Republicans and Trump people, and in rural communities who are have and also when you start having fewer people in the healthcare system itself, it means that things like measles and all these other things that the vaccine diseases, right? It becomes far harder to manage them when a big chunk of the population is all of a sudden outside of the healthcare system. I mean, one of the big learnings that America should have taken away from COVID is that you can't actually deal with a pandemic unless everybody's actually in the healthcare system, right? But obviously, Kennedy and his team have extremist, fanatical views about these things, and I think this whole idea that what they're doing is somehow going to make America healthier than we are now. It is one of the great big lies of this time. But talk about, like, you live in a state, right, Michigan. You're on an ACA you're on the ACA yourself. You're still going to need health insurance, and the state of Michigan is going to have some number of people, 500,000 people who are all of a sudden uninsured. And they're still the citizens of the governor and the state legislature. I mean, what kind of is this really a way for the federal government to sort of shed the burden, the federal burden, in order to give tax cuts to the wealthiest people in the United States and shoving these responsibilities down to the states? I mean, how do you think this is going to play out in the states over the next couple of years?
Yeah, and that's exactly the thing, is that as you mentioned, I mentioned that my own family is on an exchange plan, and we're already having discussions about, well, what are we going to do? If this does come to fruition, what are we going to do for our healthcare coverage next year? And so what's going to happen is, I mentioned there's around 24 million in the exchange plans, another 1.8 million in the basic health plan, which is sort of an offshoot of that in Minnesota, New York, and Oregon only. And not all of them are going to lose coverage. What's going to happen is, in a lot of cases, they're going to have to downgrade to a worse plan. So if you're on gold, you go to silver. If you're on silver, you go to bronze. If you're in PPO, you go to an HMO, which means that you're going to be, higher deductibles, higher co-pays, and so on. So a lot of people will, they'll still have coverage. It'll just be worse, and they'll be paying more for it. But others, are going to have to make a decision about, in some cases, they may, if they're self-employed, they're going to be scrambling to try to find a job with a larger employer that provides healthcare coverage, assuming they're hiring, right? So that's what some people will do. What others will do is they will drop their exchange coverage and they will move to so-called junk plans. Basically the non-ACA compliant policies that don't have any or many of the patient protections. If they're in a situation where that might work for them. But then a lot of others are just going to have to basically go bare entirely, which now you're talking about, basically emergency, cross your fingers care, right? Pray you don't get hit by a bus or get cancer or whatever, which is right back where we were before the ACA, so, but in addition to that, in terms of shifting the burden onto the states, this is one of the ways that the congressional Republicans are trying to argue that Medicaid won't be cut. See, what they're saying is, well, it'll just be up to the states. That's all. They'll just have to pay for it. And then when the states aren't able to come up with the hundreds of billions of dollars and that we're talking about, then all of a sudden, well, blame your state legislature. They should have done it. They should have paid for it. That was a big argument. A prior version of the bill, where they were originally talking about, lowering the FMAP, lowering the federal matching rate across the board. That was like their biggest talking point there. They got backlash on that, so instead they switched to some of these other things. But it amounts to the same thing. It's basically just dumping. Yeah, it's dumping it on the states. And I'll also note, in some cases, the states are paying for the coverage themselves, and they're saying, nope, we're going to penalize you for doing that, as in the case of undocumented immigrants, which there's a couple of states, California and Colorado, I think, where there's a couple of states where the states pay for a Medicaid-like program. It's not technically Medicaid, but it's basically Medicaid. It's very similar, but it's paid for by the states, not with federal dollars, with state dollars. And so there's a provision in the bill that says that any state that does that pays for it themselves for this population that they don't like, that we're going to penalize you by giving you even less, federal money if you do that. It's going to be a horrendous burden on the states. And the reality is there's only a couple of states that are going to, that I can think of that would have the resources to be able to make up even a portion a significant portion of the gap. Some will try. I mean, some blue states will certainly try. I'm sure they'll try to fill in where they can, but it's not going to be entirely, and it's probably going to be a small fraction at best. And that assumes that their economies aren't being devastated in the process. They may not be able to afford even that if they're seeing all this devastation, especially if they're a state that, like, for example, Massachusetts, very blue state. I'm sure that I'm sure that they want to, except that a lot of research universities, right? A lot of medical research, technical research is done in that state. So you lose all that funding there. I don't know if they'll be able to.
Well, and I think what this gets to pull back and go back to the big picture, right, for a second, is that, I've described Trump's administration as one bent on sabotage, right? That the way I describe their economic policy, healthcare policy, foreign policy, the attack on academia and research, that this feels more like sabotage than a strategy for American greatness. And I think that the notion that our entire public healthcare system is about to take an incredible hit, and for what purpose, right? I mean, for what reason? And, is it tax cuts for the wealthy? Is it that, that you've got these quacks that have now taken over HHS and the FDA? I mean, the malevolence of this, right? Because this is intentional. This isn't, a stumble, or, the tariffs. You could argue that maybe Trump really didn't understand exactly what was going to happen with the tariffs, although, because he's not any longer really in control of the world around him. But they know exactly what they're doing here, right? Mm-hmm. I mean, the level, to your point, the granularity, the punishment, the things they thought through, right, about sort of gaming out the whole healthcare system. This is an attack on America's public health that probably has no real analog in all of our history. And it is the level of malevolence and maliciousness and whatever the words are that we're all going to come to use. It's jaw-dropping. It's shocking. It is breathtaking in its inhumanity. And as I've often said here at Hopium, that if the very first thing that you do is to vaporize global health programs and food programs for the poorest people in the world, causing hundreds of thousands and now potentially millions of people to die, if you're okay with that, and if that's something that morally and politically you're okay with, then you're okay with, like, sabotaging the healthcare for 20, 30% of the United States. I mean, there's an inhumanity to this that is staggering to me, to be honest, and a sense that we're not all in this together, that they're willing to let fellow Americans sort of suffer incredibly based on their greed and their ideology and their fanaticism. And there are days where this kind of the ugliness of all this becomes a lot to take. Mm-hmm. And I'm just wondering if you want to, land the plane here in responding to that, and how do you really describe? I mean, you've been writing about this stuff every day for years, right? We've made unbelievable progress. To your point, the American healthcare system has got all sorts of issues that we haven't totally, dealt with yet. But for example, there's no way to deal with chronic disease in the United States if you're dropping 20, 30, 40 million people out of health insurance, right? You can't manage chronic disease unless people are in the system, right? There isn't any way to do it. And so even that part of the bullshit Kennedy Make America Healthy Again agenda is also a huge lie, right? There isn't any mechanism for them to do any of that, right? What, better diets and more exercise? I mean, the whole thing is just insane. And so just reflect, as somebody who's living this every day and seeing the progress that we've made, how do you make sense of it all?
Well, I'm gonna give two points, which are both, like, one is even grimmer than the other. Okay. The first one would be, I posted about this, I think, a few months ago. I'm not sure, that a lot of this reminds me of, I used to play Sim City, right? I assume you've played that before, right? Where you get to build up a thrive, from a small village to a thriving metropolis virtually, right? Fun game. And what I would do is, once in a while, if you played a game for a long time and you've built it up from a handful of people to this huge, massive metropolis, you start to get a little bored. And what I would do is, once in a while, if I got really bored, I'd deliberately cause an earthquake, cause a fire, slash, fire funding, funding for the fire department to zero. See what happens, drop taxes down to zero or raise them up to 100, just to see what would happen.
Or cut the National Weather Service, right? And see what happens, right?
Just out of sheer let's see what it would be interesting. So that's, part of it reminds me of that. Part of it, I think, is literally they just don't give a crap. And I think somebody smarter than me, basically said that the rest of us are all NPCs, that basically that if you're not part of that cohort, that they literally think that anyone else is not an actual human being. They're just numbers or just them little bits of digital bits.
It's them. They're them.
Right. The other even darker thing I would say, and specifically in terms of RFK Jr. and his echelon, is there's actually I actually do see a method to the madness in terms of claiming to make America healthy again, which is simply if everyone who's sick dies, then guess what? The rest of the population presumably is healthy. See, problem solved. If you want to improve the average health of the population, you just kill off the sickest, and then the rest is your risk pool just got a lot healthier. And I've written about that. I've done some presentations about that where I use that exact example where basically, when I'm breaking out, I'm explaining how risk pools work, and you have how like 5% of the public in any large population, around 5% of the public generally will utilize around 50% of all healthcare spending, right? And it varies a little, but that's sort of a rough ballpark. Well, if that 5% dies, then the other 95% suddenly their healthcare costs just dropped in half. That's horrible, and it's cynical and it's repulsive, but I think that's kind of, I don't think they'd ever actually come out and admit it. But literally the other day, Joni Ernst in Iowa got into a heap of hot water because she basically said the quiet part out loud. Hey, everyone, they said, people are going to die. Well, hey, we all die. What's the big deal? So yeah, that's kind of where I'm at.
Well, Charles, that this is actually what they're arguing now. The defense of what they're doing with the cuts is they're now saying we're not actually cutting Medicaid, right? We are kicking people off who are undeserving in order to preserve the program. They're actually making a version of the eugenicist argument right now as their central defense of what they're doing, right? This is now what's happened in their polling, right? In their desperate effort as the president, as our leader, I don't call him our president, our leader, wrote on social media yesterday that we're not cutting Social Security, Medicare, or Medicaid. And they're going on television claiming, right, that they're not cutting Medicaid. They're claiming that their bill is not going to increase the deficit, right? They are making extraordinary misrepresentations and lies and all of this, but they are actually moving towards a soft version of the eugenicist argument in their public communications now, right? Which is that for all of you who are on our team, you guys are going to be okay. It's those other people, right? However, that's not true, right? The problem where, Ron Brownstein and I did this long interview the other day where we had a version of this conversation where, I think that what the Republicans, are representing that they're taking care of the white tribe, to their own voters. Like, we got you guys, right? We're there. But in fact, that's actually not what's happening. The tribe has been narrowed down to oligarchs, and that now if you live in a rural area and you're a poor Republican and you are you're effed, right? Tariffs are hurting you. You're losing your workforce because of the mass deportation raids, right? And so part of what's been interesting to me about this eugenicist approach that you're describing is that where they have betrayed their own voters is that the object, this is why I think they're doing so much public immigration stuff, because it's the bread and circuses, right? Like, we're going after all those other people, but in fact, they're going after their own people, and that they need to distract their own people from understanding that Trump is, a profound liar and a betrayer of everything he said about the economy growing and costs going down and you having better health care and all that. I mean, all of this is just untrue. And so anyway, I'm going on too long about this, but I think I'm grateful for you bringing this up, because I think this has been difficult for me to be able to articulate because it's so, again, it's so dark and malevolent, behind it. But here we are.
Yeah, appreciate that, and yeah, I think that's the last point that most Americans are. I think a lot of not just in the media, but just at homes around the country, are having trouble wrapping their heads around. They can say, why are they doing that? They can say, well, that's stupid, or that's not logical. That doesn't make any sense. But they're having trouble grasping the concept that it's deliberate.
Right.
Or when you say either they want you to die or they do not care if you die, that's not hyperbole. That's like literally, and I understand it's human nature to want to believe, if not the best of people, at least not to believe the absolute worst. And I'm sorry, that's the only conclusion I can come to, is that these are the absolute worst people. And I just will throw in one final, number point. You mentioned about going after, them versus us. I actually, just for the heck of it, I actually did break out the enrollment data by congressional district out of curiosity. And as it happens, there are more Americans on Medicaid through ACA expansion in the blue districts. That is true, but there's still a good 7 or 8 million in the red districts, and there's actually more in the red districts who are enrolled in ACA exchange plans than in the blue districts. So when you combine it all together, it's basically almost 50-50. So it's like, basically, as you said, we're all going to be screwed here. So
yeah.
Even if you're okay arguing that, that it's okay if they die, which is a horrible argument anyway, but even if you're okay with that, no, you're in trouble too.
Yeah. And I think this is where the big lie, in the sense of betrayal, right, that I think many Republican voters have begun to feel. I mean, Trump's going to keep his 35% no matter what happens, right? But it's everybody else that matters in politics. It's the 10, 15% of the country that is more loosely connected to Trump, that voted for him, mm-hmm. that are coming to wake up to understand what he, going beyond the rhetoric, what they're really doing. And it's why everybody, at what we've been doing at Hopium in terms of the actions, is we've been very focused on talking about the ruinous economic plan, the tariffs plus reconciliation plus mass deportations plus the gutting of research and science and academia, that all together, this is like a strategy for national sabotage. And it's why we have to keep working as hard as we can, because we all deserve better for this once great country. And it's why we got to stay in the game and keep working as hard as we can to share this knowledge and understanding with our colleagues and our peers. So hopefully we can derail. I mean, today Elon Musk came out against the president's bill. I mean, who knows what that means, right? I mean, Elon, he had too much ketamine this morning, but this thing is,
he's in withdrawal from it. Who knows?
He's withdrawal. This is more. I think this bill is. I believe this bill is, having worked in Washington for over 30 years, I think this bill is more fragile than people understand. And I think that the senators are far less enthusiastic about this thing than the House is. And I think it's why over the next few months, we just have to keep working as hard as we can. Charles, listen, thank you. You have been indefatigable and just worked so hard for so long and been, challenged all of us, given us incredible data. You also raise money for candidates like we do here at Hopium. Thank you for all of that work you do as well. You've been, you've made an incredible contribution over the last few years. I'm just really grateful you were able to come by today.
Oh, thank you very much. I appreciate that. And I appreciate you having me on the show. And thank you, for all your work as well, because you've been doing a lot as well.
Yeah, we're all in it together. Yeah. See you, everybody. Thank you, Charles. Take care, everyone.